Well, hello and welcome to all of you around the world. I'm Fiona Lang-Sharpe, IBCLC Director of Communications and one of the MCs here at Gold Learning. Today, we're talking all about our Gold Midwifery Online Conference 2026. That's right, we are geared up, ready to go, and we can't wait to, of course, showcase this incredible event that year after year has proven to be so fruitful to all of you. That's why you keep coming back. And if you haven't been with us before, well, let me tell you, we're going to give you a little bit of a highlight of what's coming up with this year's Midwifery Conference. Now, this year, we're in our 12th year, if you can believe that, which is really exciting for us. It tells us that this product is very much needed. But not only that, it is a community of colleagues, friends, practitioners, new and old, that come to us year after year in order to be able to get their clinical skills, to connect with others in the field, to look at their research with a critical lens and put all of those great things into practice to serve those families that we love and adore. So let me tell you just about a couple of things coming up. We have an incredible representation again this year from speakers around the world, and that's who we are here at Gold Midwifery. We're an international consortium of speakers and of course friends who join us. Over 15 countries represented this year, including Italy, UK, USA, Australia, Canada, and Sweden. And in the main program, we have 13 and a half hours of education, which is really going to help you fulfill some of the needs that you might have when it comes to accreditation and getting your CEUs. We're offering, of course, that full spectrum. As I mentioned, we love things here when it comes to real life, putting it into practice. But we'll also bring you the current research. And that, of course, by far is something that there is a demand from that, not only from clinicians, but from our families. They're educated, they want to know more, and they're ready to learn and grow with us as well within that field. We also love to bring you elements that are exciting, translatable, that you can learn from. All the multitude of learning styles that we have out there, we want to make sure that you feel like you can show up with us and that you can get something out of it. So we'll include things that are interactive, our live sessions that meet the needs and demands of those that need conversation, that want to demand more, that want to engage and share their experiences. Those things have become so valuable to so many of us here at, of course, Gold Midwifery, and we can't wait to see you there. However, we do have those recorded presentations as well. They're going to be, easy for you to log into at your own pace. In between, serving your families. Some of us, don't have the luxury of taking, maybe a bigger time off, or maybe it's just that time of year with you. The babies are coming and there's no stopping them, or you're serving families at capacity. And we want to make sure that you still have an opportunity to come back and learn with us. We've also made sure that we are reaching and exceeding the highest standard of accreditation in the business. And what that means is that we have put together a program that is solid in every capacity, but it also, when we meet with the boards, those boards that we have to meet with for accreditation purposes, with MEEC to get your CEUs, with SERPs, with ACNM, and all the other bodies that we work with. That's why this program also translates right across the birth field for others that are working in the field: midwifery, nurses, doulas, IBCLCs, physicians, childbirth educators, and of course, students that are coming up in the field. Now, you can find all the details as we go through things today. And of course, I'll be introducing our friends here in just a moment, but please head over to goldmidwifery.com to get all those details. We've put together an incredible package that you can read through, on your own time. But we are going to get into some of the content today, and I will start us off with just talking about our keynote presenter, because this is the day that everything sort of begins live, and you don't want to miss out on this opportunity. Our keynotes here at Gold Midwifery are free and open access. Did you hear that? That's right, they are free and open access, which means that there's no excuse and no reason for you not to come, for one reason. And we do this because we want to share in our community and reach as many people as possible. So February 2nd is the day that you can mark on your calendar right now for that open access presentation. And it is with Nicole Morales. Now, Nicole has been with us before. for an incredible dynamic presenter, and she is speaking on a topic that is very close and near and dear to her heart: shoulder dystocia beyond the biomechanics. Now, this topic, of course, shoulder dystocia, my goodness, sometimes it can entail, all sorts of nerve-wracking, sort of areas in our field, and people can be thrown off, or families can be worried. And so we want to go through some of all the things that really, this topic represents, but really look beyond that, as the topic alludes to as well. So we'll be looking at all sorts of things. Nicole's going to take us on a journey talking about the different and multiple types of shoulder dystocia, the external signs of normal rotation of the shoulders, the prevention. Of course, that's key to everything. We know that. But also looking at how to use the flip-flop acronym to remember maneuvers and ways to leverage the teamwork and communication, which has to be the key component in shoulder dystocia, and some of those concerns that you might have. So please come on the date of February 2nd. Invite your friends, colleagues, and anyone you know in the birth field. It's going to be an incredible day of learning, and you can get all the details on our website. Well, it is that time. It is my pleasure, of course, to introduce to you all of our guest friends here today who are going to be sharing. And, they're friends of mine, colleagues. I work with them almost every day, I would say. And it is an absolute pleasure to bring them back and introduce them to you once again. They are key in putting all of these programs together. And we'll talk more about our extended team members in just a minute. But please welcome Fleur Bickford, who has an extensive background in perinatal health and is a registered nurse and international board-certified lactation consultant. Fleur's clinical experience, combined with her professional experiences with educating both families, healthcare professionals, lend themselves well to her role as Director of Educational Programming here at GOLD Learning. So welcome to you, Fleur.
Thanks so much, Fiona.
Yeah, and welcome to Kristin Staricka. She is an IBCLC and a childbirth educator with a background in multiple clinical settings. She joined GOLD's education planning team in 2022 and brings experience planning at lactation education events on local, regional, and national levels. Welcome, Kristin. It's great to have you here.
Hi, it's so nice to be here.
And welcome to my friend and colleague, Kristin Schwarz, who is a licensed midwife and childbirth educator and, of course, MC at GOLD Learning. Kristin is passionate about educating families and advocating for informed decision-making. Welcome to you, Kristin.
Thank you. Thank you so much, Fiona.
We got Kristin and Kristin here today. So yeah, welcome to everyone. It's so good to have you here today. And we're going to go through some of the content. So listen up, because our friends here are going to relay back to what you're going to be learning, seeing, and hearing, and maybe inspiring you to think about how this is going to fit into your education this year. So Kristin, I know being a midwife, of course, this is your life's work and you love it so much. You've been fully immersed in this field for a long time. So tell me a little bit about what you have seen in the program and some of the things that you're looking forward to.
Well, thank you so much, Fiona. Yes, this as a midwife, of course, is very near and dear to my heart. And as midwives, we need our CEUs. We all know that, right? And of course, this program is fully accredited. What makes this program so incredibly valuable is the skill building. What I absolutely love that we are here at GOLD, we have our presentations offer skills that you can take right into your practice the next day. And I would like to focus on one here that I find absolutely fantastic, and I'm looking really very much forward to it, is the presentation, Clinical Competencies for Assessment and Repair of Birth-Related Tissue Trauma with Lang-Sharpe. So maybe some of you may be familiar with Nell. She literally wrote the book on suturing. Maybe some of you have that book at home as well. And this is a deeper dive. We're talking continuing education, right? So some of you, most of you are suturing obviously on a daily basis, but this is a skill deepening session designed to elevate your experience. And this is what's really, really important here. She will take us on a little journey together, and Nellie is a fantastic presenter. I can't stress this enough, how much I look forward to this. Also about her camera setup. She will really go through some of the steps here with you together, and we'll take a look with her together and examine clinical competencies that can enhance precision, consistency, and confidence in your suturing and wound assessment and repair. And Nell is really, really strong, has really strong feelings about this. She's not just about proficiency. She will tell you it is about mastery she's after, right? And that's what we're trying to achieve here together with her for this session. And you will learn how to fine-tune your technique and expand your professional toolkit so you can really enhance the quality and impact of your clinical care. Doesn't it sound amazing? I think that's absolutely fantastic. I can't wait for this session, but we have so many wonderful sessions here in that conference. And I want to hand it over to my lovely colleague Fleur, because there was also a presentation that specifically stood out to you, correct?
Yeah, thanks so much, Kristin. We have a presentation coming up for all of you that very excited about, because one of the things that we're always trying to do here at GOLD is bring in what is new, what is cutting edge. It's one of the things our professional advisory committee always loves to, talk about, the fact that we're bringing in these cutting edge topics. And one of our topics is titled Managing POTS During Pregnancy, Empowerment Through Quality Care. So for those of you that aren't familiar with what POTS is, it stands for Postural Orthostatic Tachycardia Syndrome. And one of the reasons why we're wanting to bring this to you is because the incidence of POTS is actually growing. It is actually fairly common during pregnancy, but what we're seeing is since COVID, there has been a growth in the number of cases of people having POTS. And despite the name of having tachycardia in the name there, it's actually not a disorder of the heart. It's a disorder of the autonomic nervous system, which is really interesting and has, some pretty serious implications when we're talking about pregnancy. So really excited to bring a speaker in who is an expert in this area and looking specifically at what happens with POTS during pregnancy. So yeah, can't wait to listen to that one. And I think, Kristin, I'm going to hand things back to you to talk about another.
Yes. Thank you so very much, Fleur. Yes, POTS, very interesting. I can't wait to learn more about that too, because as you mentioned, it is on the rise and I feel like we don't know nearly enough of it. So I'm really excited about that presentation. Here at GOLD, what we also do for our conference is interactive sessions. That is something really exciting. We have our interactive session this year is with Loredana Zordan about moxibustion for breech presentation and postnatal recovery. Some of you are maybe familiar with the use of moxibustion. It is an ancient healing practice that is still widely used in China and Japan today. But did you know, and this is something very interesting here, that you can also use it to improve anemia, to enhance postnatal recovery. That's something that's not very often known. And, what about also the evidence-based information? Where's the research on this? Yes, this is what it's part of these interactive session with Loredana Zordan. She will walk us through this and we will explore together the latest evidence showing how moxibustion may reduce unnecessary C-sections and ease labor challenges, also linked to low iron level and promote emotional and physical well-being after birth. So yes, holistic practice, moxibustion, but evidence-based. And this is very important here at GOLD, that everything that we present is evidence-based and we have the research to prove it as well. So I am very much looking forward to this. Also, it is an interactive session that I mentioned. What we do there is we offer you a little bit of an extra deep dive that you can take. It's completely optional. You don't have to do that. We put on our website a little pre-homework, some resources as well for you to check out, so you can immerse yourself even a little bit deeper and get really comfortable with that topic. So I'll hope you find this as exciting as I am, and you are looking forward to learning more about this important topic here as well. And now I want to hand it over to our lovely colleague Kristin here. You have also found a presentation that really spoke to you, correct?
Yes, for sure. So as a clinician, as an educator, Primarily, like you, I'm a communicator. We have to have good communication skills. We have to constantly be brushing up on them and thinking of new ways to communicate what we know, because what we know is useless if we can't get it out there. And this presentation on infant feeding support for Gen Z and Gen Alpha is going to be so interesting, and it's going to leave you so excited about being able to communicate better with your younger generations of patients and clients, because they use different terms, they use different phrases, and they say things in different ways. And we want to be able to not only understand them, but be able to give back information in language that makes sense to them, that they can take with them and spread to everyone that they know. And we want them to have the right information about infant feeding. And we know there's tons of that that's available online. So we want to speak the same language that they do and that they're finding online, instead of necessarily reusing all of the phrasing and the ways that we've said things for, since we were trained. So there's always a new way to explain things that can make it more exciting and more applicable for people. That's why I'm really excited about that presentation.
All right, thank you so much, Christine. Yeah, I mean, it is the key really to all things communication, and making sure that we have that evidence-based information. I want to switch gears a little bit and talk about sort of a little bit of advocacy, how to advocate for yourself, but some of those legal issues that you can run into in the birth world. And, the tone shifts here a little bit, but I think that it's really important that, you yourself listening in, need to protect yourself. You're not, everyone knows about this in the field, right? And we need to be able to develop skills in this area in order to showcase, some of those aspects. So we do have a presentation on that this year, and I'm really appreciating the fact that we can talk about this in this, forum, in a place where there is respect and understanding and knowledge, but also how to help us to continue to grow. So this presentation, At the Crossroads, Community-Based Midwives and the Legal World. Now, this presentation explores that growing intersection between midwifery practice and the legal accountability. So again, giving us a clear understanding and what this might look like. This talk will really unpack some of that regulatory pressures that you're under and community-based midwives face sometimes on a day-to-day basis. The real-world impact of litigation on practice, how midwives can protect themselves while continuing to provide respectful, evidence-based care. It really highlights this emerging trend that we're seeing that I spoke of, and the professional responsibility. And of course, the importance that we're advocating together, and that we preserve, that autonomy as well. That's something that I think speaks to all of us that work in the perinatal field, but also provides that continuous access to families, and then of course providers alike. So just making sure that overall, we have all of that covered. Now, this will be a jumping off point for many of you. Some of it will be a refresher, and those of you that are working in advocacy or have done for a long time, again, coming together and talking about this just has so much value. And again, that's why we do this conference is so popular, because it really does bring people together. So make sure that you come and join us for that presentation as well. One of the other highlights that we have as part of this event, of course, is our panel discussion. Again, talking about bringing people together. Fleur, you wanted to mention a little bit about this one.
Yeah, thanks so much, Fiona. I am really excited about our panel. We do these every year, and this is an opportunity for us to bring together several of our expert speakers, and we purposely are choosing speakers with different perspectives, often coming from different professions. And that's something we're really looking for, is hearing those different perspectives and collaborating with other professionals. And really excited that we get to do this year with a topic that Kristin, you and I had a great conversation about this, because we were talking about birth trauma. Which, yes, there's been a lot talked about there, but one of the things we ended up talking about was there's a little bit of a gap, and that was something that we really want to address. So the panel this year is titled The Quiet Wounds of Birth, Exploring Birth Trauma and Healing in Practice. So often when we think about birth trauma, we're thinking about those big emergencies that can happen, the events where, yes, it's understandable that they might cause trauma. But what often doesn't get talked about is the smaller, less obvious situations that can also cause trauma, because trauma happens when our nervous systems are overwhelmed. So we can have situations where trauma occurs in moments that other people might consider normal, where it could be emotional disconnection, unmet expectations, family drama that is going on during the birth. It could even be rupture between the provider and the parents. So a lot of different things that can happen there that can actually result in birth trauma and leave a lasting impact if it's not addressed. So really excited to dive deeper into this and look at what is birth trauma beyond just the big dramatic, emergency events that can happen. So excited for that. And the other key thing about our panel is you get to participate too. So this is one where our chat is always going nonstop. It's encouraged. This is one where, yes, we have our three experts, but the conversation also becomes, what you are contributing as well. So we really encourage you to attend that one and lend your voice to this important topic.
Yeah, that's awesome. Thank you so much. Kristin, do you want to share a little bit about our closing keynote, Karen Strange, who is not new, of course, to our amazing Gold family, but she is another legend in the field.
Legend in the field for sure. And her topic is neonatal resuscitation today, new guidelines, changing tools, and getting priorities right. If you know Karen Strange, she is not just like the expert in this, but she looks at it from a bigger lens, right? She's not just working through the resuscitation book that we know it, but she gets the bigger picture as well. And, how our nervous system is involved as well, how we as professionals present ourselves in emergencies. We know that there is the new resuscitation guidelines are coming out or are out. So she will be talking about that because we need to be always on the latest, we need to know. So,
absolutely.
But, yeah, absolutely. And it's so much more than that because, you could just look at the book yourself and work through the steps. But with Karen, you get really wonderful instructions also, to, as I mentioned before, look at a little bit of give it a little bit of a different spin and really feel confident about your skills and your knowledge in these kind of situations, Fiona.
Yeah, thank you so much, Kristin. And a reminder that Karen Strange, keynote presenter this year, as well as I mentioned at the top of the hour, our time here, that February 23rd, it is a free and open access presentation. So again, you will get all of that knowledge for free, and invite your friends. It's really important that you know about these keynotes, and that it will give you also, really the sort of the ability to look at what we're doing here at Gold Midwifery. We're looking forward, of course, for all of you to join us at goldmidwifery.com. Now, just rounding the corner here as we wrap things up, just briefly, we're going to talk about some of the add-ons that we have here. And Kristin, I know you really highlighted this as something that you found of value, and it really speaks to you.
Sure. Thanks, Fiona. This add-on package on postpartum care in practice. Now, I know people think that what we all do is we cuddle babies and we listen to birth stories and, we take care of new families, and we do. What they don't know is all the things that we're doing underneath the surface. And this is going to be a package where it's going to give you new skills and strategies for looking for those things that are hidden to other people. Looking for hidden signs of things like thyroid problems and postpartum preeclampsia. Listening for what people say and how they act that could indicate they're dealing with trauma from their birth experience, and things like pelvic health as a vital sign in the postpartum period. All of these things that aren't going to be things that people come out and say or ask questions about, we are always looking. We're investigators, so we're always trying to observe, and this is really going to help hone your investigative skills to make sure that you are taking the best care of your clients as you possibly can.
Awesome. Well, that is definitely something we don't want to miss. So thank you so much. We've also got some additional add-on packages to choose from. These packages, of course, will take a deep dive into their specific topics. And I know you, Kristin, were just going to highlight a couple of them for us here.
Yes, absolutely. Thank you, Fiona. Yes, I love what Kristin said. We're investigators. And the same goes, of course, for our next add-on package here, comprehensive care for 6 newborn challenges, diagnosis, treatment, and support. You learn about hypoglycemia, jaundice in newborn, and also, of course, something about congenital heart disease. These are all things we're trained for, as that's correct. But we need to look a little bit deeper as well. Some, as Kristin earlier said, might be hidden, right? Like it might not be obvious at first glance. And so we want to have a really keen eye on, our little ones there. We want to give the best care possible. So some of it might be a refresher, but again, there is always a little deeper nugget to discover in these presentations as well. And I think it's a well-rounded package where you find 6 presentations on the topic. Then our next add-on package is Advancing the Art of Breech Birth. I have to tell you, this is my absolute favorite. 6 presentations on breech birth. I know not all of us midwives are, depending on where we practice, are working in breech birth. Some of us may not be allowed to do breech birth, but that doesn't mean we can't be trained in it. We have to be trained in it because the surprise breech can happen at any time. So we need to be on the latest training, so to speak, of how to act, what to know, and be a facilitator for safe breech birth. These presentations are absolutely fabulous. Lots of videos you can follow along. Beautiful births there, and detailed instructions by our presenters. Not to be missed. Honestly, it's a fantastic package. And last but not least, our latched and attached strategies for neurodivergent bonding and effective feeding. Smaller package here, 3 presentations, but absolutely fabulous. It's all about the nuances of attachment, latch, and positioning that is crucial, providing effective breastfeeding support. And we know that is so important, right? So altogether, 4 add-on packages, not to be missed if you can get them all, because, we have quite a long time, right, Fiona, to watch all these presentations. Absolutely. So I'll hand it back to you because you'll tell us a little bit more about, the time of the conference and such, some key dates here for us.
Absolutely. So some key dates once again, as we round things out here. February 2nd, that was your first presentation. That's our opening keynote with Nicole Morales, talking about shoulder dystocia. So that's going to be definitely very important to you. The second one, I said, of course, we're going to have our closing keynote, and we don't want you to miss out on that opportunity with Karen Strange on February 23rd. So there is right there. That's why you get to join us right away. Now, many of you, of course, are going to come back year after year. You join us as part of a group as well, which gives you even deeper discounts. So if you've got a group of friends who are wanting to get together and planning to be part of it, don't forget to reach out to us here at goldmidwifery.com, and that will give you an even deeper discount. Catch all the savings online. Keep up to date, with what's happening, because there are some early bird specials too that I don't want you to miss. This event gives you lots of time to watch, so you're not crunched into that time. So if you are working in a very busy practice, but you do want to get your education, this is ideal for you. It's online, easy to watch. You can watch it live or on demand, as I mentioned, and it's available between February and 29th of May. So it really is an extended period of time. It will keep you up to date, and that is one of the key things that we talk about. It is accredited, but by far, it will bring like-minded people like yourself together, so that you no longer have to feel like you're working in a silo. I know there's many midwives that really are in very small practices, and many of you are in larger, institutions and thriving as well. So wherever you are in the world, we encourage you, obviously to come together. I just want to say thank you so much. And to our team that's here, and we'll talk to them just one more time here, but also to our professional advisory committee, who are a bigger part of our education team here. So thank you so much to all of you who are part of the planning process this year. These are folks just like you, boots on the ground, working in the field, and they come together every year in order to plan and look at the upcoming topics. And thank you to you listening in right now. You make a difference because we also listen to you. And if you've got something to say, please reach out to us. We want to hear from you. We always take it into consideration in planning. You haven't heard a topic, we want you to hear it. Whatever your needs are, that's what we do here, is we meet the needs of the community. Kristin, Staricka, Fleur, Bickford, and of course, Kristin Schwarz, thank you so much for being with us here today. And it is always my pleasure to be hosting these events and being part of this incredible team. Thanks to everyone for joining us, and have a wonderful rest of your day. Bye-bye for now, everyone.